Hello everyone, I'm Dr. Adam London, Director of the Kent County Health Department. Today is April the 20th. Across the state of Michigan, we have over 32,000 cases of COVID-19 as of this afternoon. We also are being told there are 2,468 deaths statewide today. Here in Kent County, we're now at 536 total cases of COVID-19 with a total of 24 deaths, which is an increase of 2 deaths and 33 cases since the same time yesterday. So again, we're seeing a steady increase. We're seeing that the curve is flatter than it could be, but we are still seeing a significant number of new cases every day. We're getting a lot of questions, of course, still. I want to answer 3 of those questions today. Number 1, about recovery, and why aren't we sharing more information about recovery? How many people are recovering? Are you hiding something by not sharing recovery data? And I want to be very clear, we're not trying to hide anything. We're being as transparent as we can be with the data. The way this works is that doctors are required to inform the local health department when they have a positive diagnosis of COVID-19. What they don't have is a requirement to notify us when someone has recovered. So our recovery tracking is a little complicated. The state is using a model where they look at 30 days of survival past diagnosis or past the onset of symptoms. And if someone has survived that period of time, the state's counting that as recovery. Statewide, we're being told there are 3,237 recoveries. Here in Kent County, we haven't had that many because 30 days ago, we only had a small handful of cases. We have, however, been working with the hospitals and with providers to get an idea about how many people have recovered. And so far, we believe there's a little over 100, maybe 110 people who've recovered here in Kent County. So if you break our cases down, we know we have 24 people. Of the 536 cases, 24 have died. There are about 100 who are hospitalized right now. There are about 300 who are recovering at home with milder symptoms. And then there's about 100 who have recovered, or 110 or so, who have fully recovered. So I want to give you that information so you have some idea of how these cases break down. You know that not all these people are sick in the hospital right now. Some have recovered, some unfortunately have passed on, some are being hospitalized right now, and some are at home recovering. And this is playing out about like we thought it would. We know that most people are going to recover just fine. They're going to get through this, mildly symptomatic. And some people are going to be more severely affected and are going to require hospitalization. And sadly, some people are not going to make it. And so far, it's following that basic trend. So we're not trying to hide anything. We will share recovery data as we become more comfortable with it, and we'll continue to characterize the cases as best we can for you. Question number 2 is about how long are we going to have to live with these precautions? And I want to be very transparent here as well, that I don't think that we're going to be completely out of the woods with coronavirus until we have a vaccination and until we have good medical treatments, good antiviral treatments that can be used to treat the most severely sick people. And so there's a good chance that for the course of the next year, we're going to be using these precautions to some extent. Now, to be clear, I know we have to reopen sections of the economy. We've got to get people back to work. We've got to start opening the world back up to learning and socialization and all these things that are also critical for society. But we've learned a lot of skills over the course of the past couple of months that I think we're going to be following and using these skills over the course of the next year until we have good treatments available. So things like the physical distancing while in stores or in social gatherings or social places, the hand washing, the use of masks, avoiding handshakes. All of these things are important for us to use going forward. I fully expect that in one way, shape, or form, we're going to be doing these things for the course of the next year. And I also think that it's very important that we remember the importance of staying home when you're sick. This is critically important. And I hope that forever gone are the days where we say things like, I'm only a little sick, or it's only a slight fever. If you have those symptoms, you have to stay home. One person's slight fever or slight cold could become pneumonia or a very serious, even life-threatening disease in other people. So please, follow these precautions, stick to them, and yes, we're going to have to start phasing in an approach to getting back to work in a smart way that protects people from coronavirus, but also make sure that society keeps running. But we're going to have to do it in a way that is protective of all people. The last question that I want to talk about right now is related to contact tracing and phone calls that you may be getting from people from Kent County. So when we identify someone who is a case of COVID-19, someone from the health department or one of the trained individuals that we have doing contact tracing first speaks with that person. And they learn where that person works, where they live, where they've been spending their time, to identify who their circle of close contacts are. That sick person is, of course, instructed to stay isolated at home, and we're going to work with them to track their health. But all of these contacts, we then need to reach out to them. And I've got an amazing staff here at the Kent County Health Department and an amazing team of volunteers from around the community and from universities that are helping us with this contact tracing. When we do contact tracing, we're talking to these people who were close contacts of the sick person. In many cases, these individuals don't know they were a contact of a sick person. And so in many cases, these people are receiving a phone call from a phone number they don't recognize, and they're being asked about their health, and they're being given guidance about how to protect themselves and others and how to quarantine themselves. And that can be a little concerning at first when you receive a phone number from someone that you don't recognize. And so I want to be clear that these phone calls are legitimate and we'll identify ourselves, but I also want to be very clear that we will never ask for financial information. We will never try to sell you something. We will never ask for your social security number. If you receive a phone call like that, it's a scam. Report it to local law enforcement. We're not going to sell you anything. We're working with you to protect your health and give you the information that you need. So please be wary of these individuals who are out there taking advantage of the fear of others in the community. And I just want to say again, thank you for all that you're doing. Right now, we continue to flatten the curve. We continue to see fewer cases than we might otherwise expect to see. Your hard work is saving lives in our community. So continue to stay positive, stay heroic, and stay healthy. I'm Dr. Adam London. Please tune again tomorrow for more. Thank you.